Welcome to another episode of Explained by AI.
Today we're doing a deep dive into the world of pacifiers.
Pacifiers.
They're everywhere, right?
It seems like every baby has one.
But there are tons of strong opinions and questions about them.
Well, let's unpack all that today.
Exactly.
So first off, why do babies love these things so much?
It's all about the sucking reflex.
That's got to be more than just a cute thing they do, right?
You're right. It's a deep instinct.
Okay.
It helps them feel secure, and it regulates their nervous system.
So those tiny pacifiers actually tap into something really primal.
Exactly.
Makes sense why they work so well then.
Yeah, and that calming effect is useful in so many situations.
Like when?
Think about a fussy baby or even during flights to help with ear pressure.
Oh yeah, that makes sense.
Or even in medical procedures when a baby needs comfort.
No, I've also heard about pacifiers and SIDS.
Sudden infant death syndrome.
Right.
There's actually research that suggests a link between pacifier use during sleep and a reduced risk.
Really?
Yeah.
I didn't realize that.
We don't know exactly why, but sucking might help keep airways open or help a baby wake up if their sleep gets too deep.
So pacifiers could be a safety measure too.
Potentially, yeah.
Wow.
But of course, like with anything, there are potential downsides.
I was going to say, there have to be some cons, right?
We'll get to those later.
Okay.
First, let's just acknowledge how many different pacifiers are out there.
Oh my gosh, walking down that baby aisle is so overwhelming.
I know, it's a sea of silicone and latex.
So how do you choose the right one?
Start with your baby's age and size.
Makes sense so you're not choking them or anything.
Exactly. The wrong size can be a choking hazard or just uncomfortable.
What about those orthodontic pacifiers?
A good question. A lot of parents ask about those.
Are they better?
They're designed to be more like a mother's nipple when breastfeeding.
Oh, interesting.
The idea is that shape helps their teeth and jaw align properly.
To prevent problems later on.
Exactly. And for breastfeeding moms, they might help prevent nipple confusion.
So the shape really matters.
It does.
And then there's the big debate. Silicone versus latex.
Right. Which is better?
Is there even a right answer?
Each material has pros and cons.
Okay.
Silicone is durable and bacteria resistant.
I see.
But latex is softer. It often comes down to your baby's preference.
So you might have to try a few out.
Exactly.
Okay, so now that we've covered all that, let's get to the big question.
Big question.
Are pacifiers friend or foe?
Let's start with the good stuff.
Okay, sell me on pacifiers.
We've already talked about how good they are at calming fussy babies.
Right. So it's like magic sometimes.
And that can be such a relief for parents,
For sure.
especially during colic or sleep regressions.
I bet.
Any other benefits come to mind?
Well, we've talked about SIDs, but is there anything else?
Pacifiers can be huge for sleep.
Really?
Yeah, babies who use them tend to fall asleep faster and stay asleep longer.
So everyone gets more rest.
Exactly.
Now, what about those downsides we mentioned?
Yeah, let's get into those.
What's the biggest concern?
A lot of parents worry about dependence.
Yeah, that makes sense.
Yeah.
Babies getting hooked on their binkies.
Right, and it can make weaning harder.
I see.
But if you're mindful about how you use them and wean at the right time, it's usually manageable.
Okay, so it's all about balance.
Exactly, using them as a tool, not a crutch.
What other risks are there?
One is the potential impact on dental development.
Like their teeth coming in crooked.
Yeah, especially if they use a pacifier past the age of 2.
So how do you avoid that?
Moderation is key.
Okay.
And those orthodontic pacifiers we talked about can help,
Right.
but limiting pacifier use as they get older is still really important.
Got it.
Anything else you're wondering about?
Yeah, besides dependence in teeth, are there other things to keep in mind?
For breastfeeding moms, nipple confusion can be an issue.
How so?
If you introduce a pacifier too early before breastfeeding is well established, it can mess with their latch.
Because it's a different sucking motion.
Exactly.
So timing is key there.
It is.
What about hygiene?
Oh, that's a big one.
Babies put those things everywhere.
You have to keep them clean
Really clean.
to prevent bacteria and fungi that can cause infections.
Like thrush.
Yes, especially for babies under 6 months.
So sterilize.
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 And always check them for damage and replace them when needed.
Sounds like pacifiers really are kind of a double-edged sword.
Yeah, they have great benefits.
Some risks, too.
Exactly. So you have to weigh those carefully.
And to make the best decision for your baby and your family.
That's what it's all about. And it's interesting how differently people view pacifiers in other cultures.
Oh, really?
Yeah, there isn't one universal approach.
That's fascinating.
For example, in Scandinavian countries, pacifiers are super common.
Like everyone uses them.
Pretty much.
Huh.
They see them as a way to promote self-soothing and independence.
So it's a good thing.
Exactly.
Oh.
But in some Asian cultures, it's less common.
Why is that?
They emphasize a lot of close physical contact between moms and babies,
I see.
and a pacifier might be seen as getting in the way of that.
So cultural norms really shape how we see these things.
Absolutely.
It's crazy to think about.
And speaking of different views, there are a lot of misconceptions about pacifiers.
Oh yeah, I've heard them all.
Like what?
That they'll ruin your baby's teeth or make them talk later.
Right. Those are common ones.
Is there any truth to that?
Well, we have to separate fact from fiction.
Okay.
Prolonged pacifier use can increase the risk of dental issues.
We talked about that.
Exactly. But if you wean them by the recommended age, it minimizes that risk.
So it's not a guarantee.
Right.
Oh.
And as for speech development, the impact is usually pretty minor.
Especially if you limit use as they get closer to 1 year old.
Exactly.
Okay, so it's not all doom and gloom.
Nope. It's about using them wisely and knowing the risks.
So what if a parent decides pacifiers just aren't for them?
Or maybe they just want other options for soothing.
What are some good alternatives?
Well, nothing beats good old-fashioned human touch.
Like cuddling.
Exactly. Cuddling, skin-to-skin contact, baby wearing.
All that good stuff.
It's so effective for soothing a baby.
And it helps you bond.
Exactly. Your voice is super powerful, too.
Really?
Oh, yeah.
I would have thought it would be annoying to them after a while.
Not at all.
Yeah.
Singing lullabies, talking softly, humming, all of that creates a sense of calm.
Makes sense.
What about offering a toy or blanket?
Oh, yeah, like a lovey.
Exactly. That tactile sensation can be really reassuring.
And if they're really fixated on sucking, is there anything besides a pacifier?
You can try offering a clean finger or knuckle for them to suck on.
Oh, yeah, that works sometimes.
But make sure to wash your hands really well first.
Of course.
Hygiene is key.
So there are a lot of different things you can try.
Exactly. It's not just pacifiers or nothing.
And every baby is different.
So true. What works for one might not work for another.
It's all about experimenting.
And paying attention to their cues.
Like, are they actually hungry or just need a change of scenery?
Right. Sometimes distraction is all it takes.
Speaking of distraction, let's talk about weaning.
Ah, the big question.
How do you say goodbye to the binky without a total meltdown?
It's definitely a transition, but it doesn't have to be traumatic.
So how do you do it?
Timing is crucial.
Okay.
Most experts recommend starting around 1 year old.
So they're not too attached yet.
Exactly. And aim to be done by 2 or 3 years old.
Got it.
And once you start, you have to be consistent.
Even when they're giving you those puppy dog eyes.
Especially then.
That's tough.
Giving in just makes it harder in the long run.
So stay strong.
You're not being mean. You're helping them avoid dental problems later on.
What are some ways to make it easier?
Gradual reduction is usually best.
Instead of cold turkey?
Right. Start by limiting pacifier use to certain times.
Like naps and bedtime.
Exactly. And then gradually decrease those times.
Over a few weeks or months.
Yeah, slow and steady.
What about giving them something else to cuddle?
That can help a lot.
Like a special blanket or a stuffed animal?
Exactly. It gives them that sense of security.
And distraction can help too.
Right? Absolutely. If they reach for the pacifier, redirect their attention.
Play with them or read a book.
Anything to get their mind off it.
And don't forget to praise them.
Yes, positive reinforcement is huge.
Makes them feel proud of themselves.
Exactly.
So weaning is all about patience, consistency, and creativity.
You got it. It really comes down to this: pacifiers are a tool.
Not a necessity.
Right. And there's no right or wrong answer.
Just what works for your family.
Yeah, exactly.
You have to trust your instincts.
And pay attention to your baby's cues.
Every baby is so different.
It's true. What works for one might not work for another.
So find that balance.
Between comfort and independence.
Trust your judgment.
And remember, there are tons of resources out there to help.
If you need advice.
Definitely talk to your pediatrician, a lactation consultant.
Or a parenting group.
You're not alone.
And in the end, the most important thing is that your baby feels loved and safe.
Exactly, and secure.
Pacifiers or no pacifiers.
It's just one small part of the bigger picture.
So to all the parents listening,
You're doing great.
trust yourselves, enjoy the journey.
And savor those moments.
Because they grow up so fast.
Before you know it, the pacifier days will be a distant memory.
Well, I think we've covered just about everything.
The science, the practicalities, the cultural stuff.
Hopefully you're feeling informed.
And ready to make the best decision for your little one.
Parenting is a journey.
With ups and downs.
Sleepless nights and amazing moments.
And embrace it all.
And don't be afraid to ask for help.
We're all in this together.
So that wraps up our deep dive into pacifiers.
We hope you learned something.
And as always, we'd love to hear from you.
What topic should we tackle next?
Do you have any topic that you would like to have explained? Drop it in the comments.